In this video, we'll discuss about thyroid function test. What is mean by thyroid function test? These are the tests done for assessment of thyroid functions, or these are the tests which are done for the diagnosis of various thyroid disorders. So, there are many routinely done tests in laboratory for assessment of thyroid function. So, what is thyroid gland? It is an endocrine gland. It is an endocrine gland situated in the front region of the neck. In front of trachea, it is a bilobe gland having left and right lobe connected by an isthmus. So, it is an endocrine gland situated in the front region of the neck. In front of trachea, it is a bilobe gland. What is the prime functions of thyroid gland? To secrete thyroid hormone, that is T3 and T4. T3 means triiodothyronine. D4 means tetraiodothyronine or thyroxine along with calcitonin, which is secreted by parafollicular cells of thyroid gland. So these hormones, these T3 and T4, this is important functions of thyroid gland to produce the thyroid hormone and calcitonin. Thyroid hormone T3, T4 along with calcitonin. Apart from this hormone production, it has number of functions in our body. Means it increases BMR. Then it helps in the synthesis of protein. Then it causes the increase in blood glucose level. It causes utilization of lipids. It is responsible for water and electrolytes balance in our body. Then thyroid gland, it is our thyroid hormone. They are responsible for development and growth of an individuals. It is responsible for maturations of brain. So it has lot of functions in our body. Secrete T3, T4 hormone along with calcitonin, increase BMR, synthesis of protein, increases blood glucose level, utilization of lipid, responsible for water electrode balance, then responsible for growth of individual, then maturation of brain. So these are the lot of functions. These hormones, mainly T3 and T4, production of this hormone takes place in the thyroid gland with the help of iodines. So production of these hormones takes place in thyroid gland along with the help of iodine. Iodine molecules get attached with tyrosine residue of thyroglobulin and result in the formation of monohydrotyrosine and dihydrotyrosine, which is coupling reaction result in the formation of T3 and T4. This is how the thyroid hormone are produced in our body from the tyrosine. Now, this is the control of the hormone secreted by the anterior pituitary gland. So, this T3 and T4, they are produced in the thyroid gland. Suppose this is thyroid gland. This is the left and right lobe. the production of hormones, thyroid gland under the control of TSH, thyroid stimulating hormone. So this hormone T3 and T4 mainly produced in thyroid gland controlled by thyroid stimulating hormone TSH, which is produced by anterior pituitary gland, which is controlled of thyrotropin releasing hormones. It is secreted by the hypothalamus. So it is known as hypothalamus pituitary thyroid axis. This thyroid stimulating hormones, which is produced by anterior pituitary gland, which is control of thyrotropin releasing hormone. It is secreted as hypothalamus pituitary gland axis. This T3 and D4 inhibit THR level, thyrotropin releasing hormone level. So this is how this production of T3 and T4. It has number of functions in our body: metabolic function, development of growth, etc. There are some terminologies: hypothyroidism, hyperthyroidism, subclinical hypothyroidism, primary, secondary and tertiary disorders. For example, hypothyroidism. Hypothyroidism means a decrease in T3 and T4 level. It is known as hypothyroidism. Its result in severe cases cretinism in children and mixed edema in adult. So hypothyroidism cases, severe cases result cretinism in children and mixed edema in adult. Second condition, hyperthyroidism. Means increasing thyroid hormone T3 and T4, along with there is decrease thyroid hormone, thyroid stimulating hormone. In hypothyroidism, decreased T3 T4 level, increased TSH level. Here increasing T3 and T4 level, decreasing thyroid stimulating hormones. Then subclinical hypothyroidisms means the subclinical hypothyroidism, there is the normal T3 and T4 level, there is normal level of T3 and T4, but TSH level is affected. TSH level affected means there is increase in TSH level, but a normal T3 and T4 level. It is known as subclinical hypothyroidism. What is mean by primary, secondary and tertiary? When the disease affected thyroid gland, disease affect this thyroid gland or decreased production of hormones due to disease. It is known as a primary disorder. When it affected that pituitary gland, it is known as secondary disorder. Then when it affected hypothalamus, it is called as tertiary thyroid disorder. This one will affect thyroid gland because of disease, means primary thyroid disorder. Affected pituitary gland means secondary thyroid disorder. Affected hypothalamus means tertiary thyroid disorder. So these are the different terminology using in thyroid function test. Decrease T3 T4 level, increasing TSH level, hypothyroidism. Increasing T3 T4, and decreasing TSH, hyperthyroidism. Normal T3, T4 level, but increasing TSH, subclinical. This thyroid gland affected because of some diseases. This one name is called primary thyroid disorder. Pituitary gland means secondary thyroid disorder. Hypothalamus means tertiary thyroid disorder. Now coming to causes of hypothyroidism. Main causes in India of hypothyroidism: iodine deficiency goiter. In developed countries, it causes Hashimoto's thyroiditis. Hashimoto's thyroiditis. What are the symptoms? It will causes constipation, dry skin, hair, then facial puffiness, cold intolerance, decreased sweating, and impaired memory. Then confusion, low speech, and motor activity. Then in the case of hyperthyroidism means it will causes various disorders: fatigue, weight loss, heat intolerance, increased sweating, warm and moist skin. Main examples: Graves' disease, thyroid stimulating hormone secreting pituitary adenomas, and multiple nodular goiter. Now coming to diagnosis of thyroid disease. The mainly done test for the assessment of thyroid disorder TSH level. Then free T4, free T3, total T3 and T4 level. Free means it is free in the blood. Total means it is bound to albumin plus this free form. The thyroid hormone presented in blood bounded form, bound to that globulin. Thyroid binding globulin or thyroid bonding albumin. These are the circulatory form of thyroid hormones, mainly in the bounded form. When we establish the both bound and free form, it is known as total. When we measure that available free hormone in the blood, it is known as free T3 and free T4 form. And free T3 and T4, it indicate the current thyroid status, current status of hormone which is available in the for that work. TSH is sensitive and specific test for assessment of thyroid functions. Suppose if you are suspecting hypothyroidism, if there is symptoms like slackiness, slow activity, edematous appearance with enlargement of gland, thyroid gland, and you are suspecting these thyroid diseases with a lower level, suspecting hypothyroidism. That algorithm like this: hypothyroidism, TSH level decreases. Here TSH level increases, then decreases in free T4 level. First condition in hypothyroidism, there is increasing TSH level and decreasing free T4 level. They cause maybe primary hypothyroidism. It is important. Primary hypothyroidism. Primary hypothyroidism in India iron deficiency goiter. In developed countries, Hashimoto's thyroiditis, primary hypothyroidism, go for TPO. Thyroid peroxidase antibodies, microsomal antibodies, the anti-thyroid peroxidase antibodies, also known as anti-T. Anti-TPO antibodies are microsomal, also known as anti-microsomal antibodies. If these antibodies are positive, these both antibodies are positive, it indicate Hashimoto's thyroiditis. If these antibodies is negative, it may be due to iron deficiency goiter. So we first estimate TSH level. T3, T4, TSH, free T3, free T4. They are mainly done with the help of RIA, ELISA, hemiluminescence immunoassay, electrohemiluminescence electroassay. These are the tests mainly used for assessment of that hormones. In second condition, if there is increasing TSH level with a normal level of free T4, it is due to subclinical or mild hypothyroidism. Third condition, a decreased TSH level and a decreased free T4 level. Then go for secondary and tertiary causes of thyroid disorder, means secondary disorders causes pituitary, tertiary disorder hypothalamic causes of thyroid disorder. To differentiate between these disorders, primary, secondary and tertiary disorders, there is one test that is known as THR, thyrotrophin releasing hormone is given, and TSH, thyroid stimulating hormone level, is measured in the blood. So here we will give thyrotrophin releasing hormone and estimate TSH level in the blood. So these are the normal range of TSH, free T4, free T3. This one total T3, T4 level. After TRH, thyrotrophin releasing hormone stimulation test, if TSH level is not changed or TSH remain as it indicate pituitary cause of hypothyroidism. And if after giving TRH, if there is delayed increases in that TSH level, it indicate hypothalamic causes, tertiary hypothyroidism. So what are the different tests done for the assessment of thyroid status? TSH, free T3, T4, total T3, T4, and antibody thyroid peroxidase, then anti-thyroglobulin antibodies. These are the test assessment of hypothyroidism. Now in case of Hyperthyroidism. There are various causes. That is, Graves' disease is the important cause, which is an autoimmune disorder. What is mean by that autoimmune disorder? Instead of protecting our body's health tissue, our body tissue causes destruction of the tissue. So what is the main role? Production. But here what it will do? Destruction of tissue. It is known as our immunity causes self-destruction of healthy tissue. It is known as autoimmune disorder. So here self-destruction of health tissue is known as autoimmune disorder. Hyperthyroidism means increasing T3, T4 level and decreasing TSH level, thyroid stimulating hormone level decreasing. If you are suspecting this hyperthyroidism, to the TSH level first, which is sensitive and specific parameter for the assessment of thyroid functions, followed by free T4 level. Here we have three conditions. There is decrease in TSH level in hypothyroidism. Free T4 level increased. It indicate primary hyperthyroidism. What is the condition? Decreasing TSH level and increasing free T4 level. It indicate primary hyperthyroidism. And the most important cause of primary hyperthyroidism is the Graves' disease, followed by nodular goiter. So primary hypothyroidism is important in Graves' disease. Now go for the test. Anti-TRH antibodies. Anti-TSH receptor antibodies or anti-TRH antibodies test means TSH receptor antibody, if positive, indicate Graves' disease. Graves' disease is an autoimmune disorder in which there is self-destruction of thyroid gland due to the production of anti-TSH receptor antibody. Anti-TSH receptor antibodies. It is characterized by exophthalmos. There are various symptoms: restlessness, heat intolerance, and so on. So these antibodies are positive in the Graves' disease. Then go for the scan, that is radio iodine uptake studies, and scan. If you will get toxic nodular goiter, in this scan you may get multiple nodular goiter. If it is indicate the single nodules, toxic nodular goiter. If indicate multiple nodules, it is multiple nodular goiter with negative anti-TRH, thyroid stimulating hormone, this one here, TRH antibodies. Anti-TRH antibodies positive means it causes Graves' disease. This antibodies negative means toxic nodular goiter and multiple nodular goiter. So goiter, toxic nodular Graves' disease, multiple nodular goiter can be diagnosed on the basis of TSH, free T4 level, TRH antibodies, and radio iodine uptake. In second condition, you may get the decreased TSH level with a normal free T4 level. It indicates subclinical condition. If along with this, you may get go for T3 free T4 T3 level. If it is normal, it is subclinical hyperthyroidism. If there is increase in FT3 level, it is thyrotoxicosis. Free T3 T4 level if normal, this condition free normal. TSH level decreasing, that free T3 T4 level normal means subclinical hyperthyroidism. Here free T3 level increases means thyrotoxicosis. In third condition, there is increasing TSH level along with the increasing free T4 level. Increasing TSH with the free T4 level, it indicates secondary causes. It indicates either resistance to thyroid hormone or it indicates the pituitary causes. For that, we need to the TRH test. TRH stimulate test assessment of TSH level. So TRH stimulation test used for assessment of TSH level. So these are the basic tests done for assessment of thyroid function: TSH level, free T4, free T3 level, total T4, T3 level, and various antibodies. Anti-TSH antibodies, which positive means Graves' disease. Nowadays, non-invasive scan, which include the USG of thyroid gland and CD scan of thyroid gland for assessment of various cancer, follicular carcinoma, capillary carcinoma, medullary carcinoma of thyroid. Calcitonin level is important marker for assessment of medullary carcinoma of thyroid gland. Calcitonin serum, calcitonin level, it is the for assessment of medullary carcinoma of thyroid gland. Then nodular goiter can also assess with the help of USG and CD scan. Then for the differential diagnosis of various cancer, there is one test, FNAC, fine needle aspiration cytology. So these are the various tests done for the assessment of thyroid functions.